at risk. So there has to be a control in care centers and health centers, but also in community centers and environments. But the situation is relatively under control. There's been outbreaks, particularly in certain centers that don't necessarily have the same care structure. But perhaps I will let Madam Minister, I don't know if you want to complete. Well, what I would say on that, and we've been saying it for many days, that the situation in the Greater Montreal, the metropolitan area, it is different than the rest of Quebec, and we have to take that into account. And in the deconfinement measures, we spoke of a week later. And of course, we will be reviewing it. Public health is going to be reviewing the situation. Montreal remains a hot sector. There's the situation in CHSLDs. And as our Deputy Premier was saying, we are seeing an improvement with the staffing availability, thanks to everybody who has come to help us out. And Je Contribue. But we have not yet won the battle. We really have to stabilize our establishments more, our CHSLDs, and that is what we're working on right now. As far as the hospital sector is concerned, I want to reassure HMR that the HMR hospital, that the oncology sector, all those important sectors are continuing. But right now, at that hospital, we can't go further with surgery. So we said that we're going to increase the volume by 50%. We'll find other venues. But what we're doing as well is that there are people who are no longer in active care who are in our hospitals, including HMR. And now we are doing an entire operation to bring those people into other safe sites. We've done a lot of work on this in the sense of having dedicated teams, cold zones, hot zones, sufficient protective equipment, so that will help. And it has to be said as well that the Maisonneuve-Rosemont Hospital, which is very close to Montréal-Nord, and we know that there is a situation in that area with outbreaks, but also it's a hospital that receives a lot of people and the emergency ward. So there are patients who have arrived, patients with COVID-19, and so therefore there's a big volume of COVID-19 patients. There's 165 right now that are being hospitalized for COVID-19, but the outbreak, we've taken control over the outbreak and we continue with our urgent activities, the ones that are urgent and necessary at the hospital. And I will end by saying that we will be reviewing in the entire island of Montreal the hospital sector, and we'll see, because there's a lot of help amongst hospitals, if there are things that we can do elsewhere than at the Maisonneuve-Rosemont Hospital, well, that would be good. Because what we're doing at the hospital right now, we believe that we'll be able to increase surgeries, for example, and other treatments that are not urgent, but that are more elective, and that we'll be able to increase them as of next week. So we are taking control over the situation. With the reopening of the regions, since the beginning, since we put ourselves on pause, and the rest of the world as well, if we decompartmentalize regions like Charlevoix, Gaspésie, Bas-Saint-Laurent, and Saguenay, and there isn't a health network that is huge, isn't there a risk that we will be losing control? Well, I'm going to let Dr. Arruda take the mic, but what I can tell you is that we have been following from day to day that curve, but we're also following the hospitalizations in general and in ICU, and we can see that there is a stabilization as far as hospitalizations and intensive care. The numbers that we give you already includes people who have COVID-19 but that don't need the technical plateau of the hospital. So we have to make that difference, because if we look, yes, but for all the regions, the numbers that we are giving you is really for the entire regions of Quebec. And the hospitalizations and intensive care, 2/3 of those people were hospitalized and got intensive care in the Greater Montreal region. So we are not concerned so much for the other regions as we are for the Montreal region right now. But on the question of the epidemiology, I would like to give the mic to Dr. Arruda. But we did do preparations in the other regions of Quebec who don't have the same volume. We understand that. But, of course, we're going to have to follow the situation very closely. Dr. Arruda? And just very quickly, I would just like to mention that those regions are going to be reopening last as well. We're talking about the 18th of May right now, and it's provided that everything goes well. In the meantime, Dr. Arruda and his team are going to be following everything. And if we have to modify dates consequently, if there's an upsurge of the curve or a situation that would deteriorate, we'll do so. And it's important to repeat it. These plans are predictions, they're plans, but it's only if things keep going well by the date where we're planning. And it's clear that beyond the epidemiology of Quebec, we have an analysis that is made for the region of Montreal that by category, communities, CHSLDs, etc. So we go more finely. And we're going to make sure that we have the same criteria for the deconfinement within the cold regions. That is to say that we make sure that there's enough tests, that there's the ability to conduct inquiries as such, and that there is leeway in hospitals to be able to do so. So I think that those regions probably have the better conditions. We hope that they're not going to experience the same phenomena as what happened in CHSLDs in the metropolitan area, first, because probability of the smaller populations, less contacts. Secondly, they are preparing themselves in terms of human resources in order to not have the problems that we ended up having. And there's PPEs more than before. So I think that once again, it's still going to keep being monitored from day to day, but I do believe that it is part, if there's one place where we can let things go a little bit more, I think it is in the regions outside of the metropolitan area of Montreal. The question has been talked about in the past few days, but when we reopen the regions like right now, what should Quebecers anticipate for this summer in the sense that we know that there will probably not be international travel? Tourism is important in Quebec. If the curve, if things go well, if the optimistic scenarios are successful, is your objective to allow and encourage Quebecers to travel between the regions? And according to you, would you be able to evaluate the evolution of the curve? When would you be able to do so, if so, in order to be able to announce whether traveling will be announced in the regions? Well, maybe a general word, and maybe Arruda can complete if he wishes. But yes, of course, we do wish that people can go back to a normal life. Eventually, we can't answer right now when that will take place, when we can see our parents, our grandparents, our friends. And there will be segmentation. Of course, the most vulnerable group, like our elderly, are probably going to have longer protective measures than other groups, like for children who are already going back to school. So that really is a situation that is evolving from one day to the next, from 1 week to the next. This week, we've already announced very significant reopenings, schools, daycares, certain aspects of the economy, and today, certain regions. It's one step in that direction, and you mentioned it. There's a potential touristic opportunity that is incredible in the constraints that we're experiencing right now, but it's not going to be tomorrow morning, as Pierre Fitzgibbon was saying, my colleague, lately. It's not tomorrow morning that we're going to go drink a pina colada in Mexico. So there's a tourist opportunity in Quebec. Certainly, we're going to want to seize it, but when we're ready to do so. Right now, everything that is non-essential, the rentals, cottages, traveling in Quebec, that is forbidden right now. It's not possible. Once it is possible, not only will we be happy to be able to make it possible, but we'll even be encouraging Quebecers, to purchase locally, all of that. So there are opportunities that are going to stem from this, but right now, I've said so, we cannot, things are not behind us. We haven't reached victory. We can't tell, on the 4th of July, you can make a reservation for hotel in Gaspésie to go see the Rocher-Percé. Right now, we can't do that. But certainly, we are working towards that. We are conscious of the fact that people are starting to get tired. Sometimes their spirits goes down and things, the weather is getting beautiful. It makes us want to go out and visit. We want to be able to give that right to people as soon as it's possible. But right now, apart from what we've announced this week, which is already a huge step, we can't give the impression that we want to reopen everything and allow everything at once. We don't want to encourage people to not follow the public health guidelines. That's a really important message. If there's one message I want to be understood today, yes, we want to reopen and we want people to keep at a distance and unfortunately to avoid visits to our parents and grandparents in the residences, to wash your hands, avoid gatherings, and all that. But yes, that's what we're wishing for, and we look forward to Quebecers being able to have a normal life. But it's going to be months yet before we have a life like before the pandemic. If you'll allow me, I think it has to be understood that the progressive deconfinement that we are going through It is to allow for commercial activities, life activities to take place. It's not an invitation to travel. And if ever we redo it, as long as we don't have a vaccine, it's going to be a different way of camping. For example, not many families around the same fire. For example, we're going to have to do things differently. And as the Deputy Premier said so well, it is truly something that is going to have to be evaluated from one day to the next. And you have to understand that in the same way that, we had essential workers for the health, for emergencies and all that, and police officers, firefighters, now we are reopening one element. It doesn't prevent you from staying in regions, but it doesn't mean that because we're removing barriers that it means that everybody's going to go from one contaminated area to go to another area that isn't, and then you end up contaminating that. That's not how we should interpret this. It's very important. We said it yesterday. You have to respect the guidelines that are given. And in the same way, if there was an important inflow of people from a hot zone, where there's still active transmission towards cold zones, well, we're going to have to put up roadblocks again. And that's not what we want to do. So we're inviting you to take advantage of a certain level of freedom associated to this deconfinement, but as much as possible, do stay around where you are right now and avoid gatherings. Perhaps they will take place clandestinely. We suspect that human behavior that happened in France might happen here. But it's not inviting because it's for yourself, it's for your own health, and especially that of our elderly. And we have to take that into consideration. But as soon as we're able to do so, we'll tell you. But as I said, we don't have a vaccine. We don't necessarily have a treatment yet either. We don't know what's going to happen. It's possible that the virus will slow down over the summer. Is it going to become even stronger in the fall? We don't know. Mr. Arruda, these past few weeks you talked a lot about mental health. You explained, for example, the reopening of schools for that reason, that it's good that children be able to find a more regular life. We're talking about children here, but earlier on, Ms. Guilbeault, you called to Quebecers' docility to respect the guidelines. But why? Is getting together not allowed if you stay 2 meters away and you're outside? Do you think that for the summer we'll succeed doing it? We can understand inside, closed off areas can be more dangerous for the transmission of the virus, but I imagine Quebecers who have a backyard, for example, who can have chairs 2 meters away from one another and have a barbecue. Could they do that this summer? Well, listen, nothing is excluded, but I can't tell you now because I really want to see what the deconfinements of the 4th, the 11th, and the 18th or later will lead to. Because human behavior, how could I say this? We always have good reasons to not feel that we are at risk, and the 2 meters is not always respected. But listen, we are the first to also want to be able to live and experience those moments again. We miss our friends. The barbecue outside, we miss it. But I think that we have to go step by step. But I want to give hope. We'll not be able to anyway, stay closed up completely, but we have to dose the risk and see really what's going to happen. Next question. Ms. Guilbeault, I was wondering whether this also holds for the border between Ottawa and Outaouais on the 11th of May. Is the SQ going to withdraw, or the roadblocks, are they going to be withdrawn? Well, the roadblocks are, random on the 5 bridges that Quebec and Ontario are sharing. They're going to be maintained because Gatineau is in a category to maintain later, but there are other points of contact with Ontario that exist. The border with Ontario has never been officially closed. It's important to, bring that clarification. There was surveillance brought. We wanted to avoid non-essential moving around. And as of the 11th of May, yes, there will be, but there wasn't necessarily systematic surveillance between the other points of contact between the Outaouais and Ontario. So we can't give the impression that the border was closed and will reopen. We do maintain those of Gatineau because there's a very high volume, and there was concern taking into account the situation in Ontario. So we've put all of that and considered it, and this will allow people moving around within the municipalities in the Gatineau area. And there's good reasons to do so, so that is a decision that was taken. Ms. McCann, what is the situation of the young handicapped people who live in CHSLDs? Do they think that they might be able to go out soon? Because they're not people who are 60 and over? That's a good question, and we're very sensitive to that situation of the people with a handicap, the young, but even people who are not as young. And I think that disabled people have to follow the same guidelines since they are in the same residence. We don't want there to be contamination. But I reiterate, I would like to take advantage to say how the government wants to change things for disabled people in CHSLDs, for example. And that is why we started working on alternative homes and alternative environments. We're 3 ministers working on that, Madame Blaine, Mr. Carman, and myself. I even have a parliamentary assistant, Madame Picard, who is working a lot on that. So in parallel, because, we still have another year of experiencing, of living with this virus without a vaccine, so we will continue working for the people who are disabled and live in CHSLDs because we want there to be alternatives for those people, sincerely. Ms. McCann, I know that you have to be, reassuring, but in the case of both hospitals where there are outbreaks in Montreal, people are a lot more worried than you seem to be. The occupation rate in Montreal hospitals is increasing. There's a scarcity of staff. People are concerned. You recognize that you made a mistake with CHSLDs. You dropped the ball. What guarantees us that you're not going to drop the ball on hospitals? I think that what can be said is that we're faced with a new virus that we didn't know, and we are adjusting ourselves often because we discover new things having to do with this virus, for example, contagion by asymptomatic people. So that was a very important factor in our CHSLDs, and now we're making epidemiological inquiries in our hospitals in Sacré-Cœur and Hospital Maisonneuve-Rosemont Hospital. What happened? Measures are being taken right now to contain the outbreaks. There are truly very important measures that are being taken, and public health is doing and conducting its inquiry. All urgent activities are maintained. Of course, it's concerning. Of course, this Montreal situation is worrying. We have to say it clearly. What helps is that we see that the people that we've called out to Anja Contribue, they do call a lot, and we should be able to add a lot of staff in Montreal because that's where we have the most needs. And that is what is going to make a difference amongst other things. And there's fewer people who are absent from the network right now. There is something, I hope that today we'll be able to tell you that we are starting to perhaps see an improvement. You can see that I'm being very prudent because Montreal is concerning. Montréal Nord concerns us. The Maisonneuve-Rosemont Hospital as well. But we're doing everything that we can to control the situation, and we are controlling it. We have controlled it at Sacré-Cœur as well. Of course, these are 2 hospitals that are very old. They're obsolete. They have infrastructure.
Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et le Premier ministre, l'Honorable Blaine Higgs. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and Premier Blaine Higgs. Dr. Russell.
Thank you, Bruce. Merci. Good afternoon, everyone. Bon après-midi à vous tous. J'annonce qu'il n'y a aucun nouveau cas de COVID-19 à signaler au Nouveau-Brunswick aujourd'hui pour la 11e journée consécutive. Seuls 4 des 118 cas confirmés jusqu'à présent dans la province demeurent actifs. Il ne reste qu'une personne à l'hôpital, mais aucun patient n'a présentement besoin de soins intensifs pour le COVID-19. La pandémie n'est pas pour autant finie. Today is the 11th consecutive day in which there are no new confirmed cases of COVID-19 reported in New Brunswick. Of the 118 confirmed cases to date, just 4 remain active. There is 1 person in hospital, but there are no patients that currently require intensive care. But this is not over. The phase that we are entering will be, in many respects, more difficult than what we have been through so far. Whether we are successful in the next 6 months, as we have been in the last 6 weeks, depends entirely on you. The individual actions of New Brunswickers have made it possible to slow the pace of the virus through our province. These actions have bought time for our healthcare system and the people who work in it to prepare for the impact of this disease. Your actions now, more than ever, will determine what happens next. Our first actions to control the virus were quick and abrupt. One day everything seemed normal, and the next day nothing did. The declaration of the state of emergency and the consequent closing of the non-essential businesses and activities required New Brunswickers to change very quickly their habits. And I'm proud of every New Brunswicker who rose to that challenge. We asked people to stay home as much as possible, and you did that. We asked you to maintain 6 feet of physical distance between yourself and others when you did go out, and you did that. La déclaration de l'état d'urgence et la fermeture subséquente d'entreprises et d'activités non essentielles ont forcé les citoyens du Nouveau-Brunswick à rapidement modifier leurs habitudes. Je suis fière de tous les citoyens de notre province qui ont su relever ce défi. Nous avons demandé aux gens de rester à la maison autant que possible et vous l'avez fait. Nous vous avons demandé de vous maintenir à une distance d'au moins 6 pieds des autres lorsque vous devez sortir et vous l'avez fait. We asked those who had come into contact with COVID-19 virus to self-isolate and avoid spreading it to others, and you did that. We asked you to help us protect the most vulnerable members of our society and to protect those who are working so hard to protect them, and you did that. And I cannot thank you enough for everything that you have done so far. Perhaps if we had stayed in lockdown indefinitely, we might never see another case of COVID-19, but I don't think that's sustainable, and I don't think that's entirely true. As long as we allow our borders to stay open for essential travel, there is always that risk. So, and from an ethics and from a human rights perspective, from a social determinants of health perspective, we have to keep all of these things in mind when making decisions moving forward, including the number of cases, the type of transmission that we see. These are all very, very important things to take into consideration. We have had to learn with COVID-19, and eventually we need to go to work, we need to go to school, and we need to move around and live our lives. But as long as there are cases globally, as long as there are cases outside of our province and just across the border in other jurisdictions, we have to remain vigilant. COVID-19 is not gone just because we have 0 cases in the province today. We will have more cases. We will have to take swift action to control new outbreaks when they occur, which we will do. We have a fantastic public health team that reacts very quickly to cases when necessary, and we have seen that over and over again. So when and if that happens, we will have to ask some of you, perhaps all of you, to accept the reimposition of restrictions on your lives until a vaccine or other treatment becomes widely available. But obviously, the more successful we are at social distancing, self-isolation, wearing community masks, hand washing, these things will be important as we continue through each phase and will be imperative for our success moving forward. Par conséquent, nous aurons d'autres cas. Nous devrons intervenir rapidement pour contrôler les nouvelles éclosions qui surviendront, et déjà c'est le cas avec nos équipes de santé publique dans les régies. C'est vraiment, vraiment important. Ils font de beau travail et ils travaillent tellement vite avec précision, et ils vont continuer leur travail très important. Si une éclosion survient, nous devrons demander à certains d'entre vous, et peut-être à vous tous, d'accepter la remise en place de restrictions sur votre vie jusqu'à ce qu'un vaccin ou un autre traitement devienne largement accessible. Mais quand on avance dans les prochains mois, les prochaines semaines, ça va continuer à être très important de rester de 6 pieds entre vous et les autres personnes, porter des masques de communauté, laver les mains et continuer à seulement sortir quand c'est absolument nécessaire. Ça, c'est des choses on va continuer à vous demander de faire, quand même que vous avez des autres restrictions qui sont plus en place, mais ça ne peut pas dire qu'on ne peut pas les remettre en place. The next phase will require continued determination from New Brunswickers. We will all have to integrate new habits into our lives so that the virus remains under control. Physical distancing is going to be with us for a while. The importance of washing your hands regularly and thoroughly and remembering to not touch your face will not go away. Les consignes de distanciation physique demeureront en place pour un certain temps encore. L'importance de se bien laver les mains régulièrement et de ne pas toucher le visage ne disparaîtra pas. Surtout dans les prochaines semaines et les prochains mois, on sait que les cas de COVID-19 seront encore dans les autres pays et dans les autres provinces et territoires. Alors, quand ça existe, quand même qu'on a 0 cas aujourd'hui au Nouveau-Brunswick, ça ne veut pas dire qu'on est fini avec le COVID-19. Ça va continuer à être un risque continuellement dans les prochaines semaines et les prochains mois et peut-être dans les prochaines années et demie et 2 ans. Alors, on faut toujours avoir l'information avec nous pour nous protéger comme des individus et nous protéger comme une province. As it becomes progressively more difficult to keep 2 meters apart between yourself and others, in those situations, that's why we're saying wear a community mask. I certainly would feel more comfortable if I was somebody who was at higher risk of complications from COVID-19, if I was elderly over the age of 60 or 65 in terms of the risks for COVID-19, if I had a heart condition, if I was immunocompromised, if I had a lung condition. I would feel more comfortable if the person who was standing, 6 feet away from me or less, I would be more comfortable if they were wearing a mask because I know that they were doing that to protect me. So we have to be comfortable with this in our society. In time, it won't look and feel so strange to see someone in a store or office with their face partially covered. That's why the movement towards the next phase is so gradual, and that's why our recommendation is still, we strongly recommend community facial masks and facial coverings. In time, we need to adjust our thinking that this becomes more normalized, and it won't be easy, and much is being asked of you, and we will all make mistakes from time to time. So be kind to yourself and be kind to others. We are all trying our best in trying times. Work is underway in the development of a COVID-19 vaccine. We have no idea how long that's going to take. As we've said before, it could take 18 months, it could take 2 years. But we know that Canadians are involved. Canadian researchers are playing a role in that process. As we focus on a vaccine for this disease, we also need to remember the importance of maintaining vaccinations for other diseases. This is National Immunization Week here in Canada. And immunization continues to be the cornerstone of public health in Canada. It is the most effective way to control, prevent, and in some cases eliminate infectious diseases. So more than ever, it's vital that infants and toddlers continue to receive their immunizations on time so that they have full protection against preventable diseases such as measles and whooping cough. Delays in immunization can have very serious health consequences for New Brunswickers, and our public health team has done an assessment around which ones we need to continue at which time, so it is really important to make sure that your child's vaccinations are up to date. Please take the time to ensure that your own vaccinations are up to date. This will save lives. L'immunisation continue d'être l'un des piliers de la santé publique au Canada. Il s'agit du moyen le plus efficace de contrôler, de prévenir et, dans certains cas, d'éliminer les maladies infectieuses. Plus que jamais, il est d'une importance cruciale que nous ruissons et les bambins continuent de recevoir leur vaccin comme prévu afin qu'ils soient pleinement protégés contre les maladies évitables comme la rougeole et la coqueluche. Des retards dans l'immunisation peuvent avoir des graves répercussions sur la santé des citoyens du Nouveau-Brunswick. Veuillez vous assurer que toutes vos immunisations sont à jour. Vous sauverez ainsi des vies. Thank you very much. Merci.
Bonjour, good afternoon. Yesterday, we announced a change to the state of emergency order. The purpose of that decision was to protect the health and safety of New Brunswickers. I know this change, which restricts temporary foreign workers from entering the province, has raised a number of concerns and questions. Tout au long de cette pandémie, notre gouvernement a agi avec beaucoup de prudence. Cette stratégie nous a permis d'avoir de meilleurs résultats que d'autres administrations. où il n'y a pas autant de mesures restrictives. We must continue to exercise caution. To do otherwise puts us all at risk of contracting COVID-19. Just this week, we are seeing reports that Singapore, which had a great deal of success in fighting the virus early on, has suddenly had a huge increase of cases. This spike has been attributed to temporary foreign workers entering the country. We cannot allow a similar situation to happen here in New Brunswick. I understand that some businesses are concerned about how this decision will impact their operations. I am sympathetic to those in the agricultural and fishing industries who rely on temporary foreign workers under ordinary circumstances. But we must all remember, these are not ordinary circumstances. Nous devrons tous ajuster notre façon de faire. Nous ferons tout notre possible pour aider les entreprises touchées. We are exploring opportunities to fill vacant positions by recruiting amongst the resources we have right here in our province. In New Brunswick, we have 30,000 post-secondary students, 7,000 grade 12 students about to graduate, and tens of thousands of unemployed people who have been displaced by the pandemic. We are also looking for ways to employ temporary foreign workers who are already in the province, who have also been impacted by this pandemic. But let's break this down and make it simple. We have 70,000 people in this province, if you include the students who are unemployed. So in total, we have 70,000 unemployed people in this province, and we need 600 to come to work and help our farmers and our processors. We will also explore the possibility of redeploying or calling back unemployed casual or seasonal workers from government departments to work in the fishery and agricultural sectors. The Department of Post-Secondary Education, Training and Labor is well positioned to help employers that typically rely on temporary foreign workers, and more information will be announced on that tomorrow or Friday. Comme je l'ai dit hier, je demande à tous les gens de Nouveau-Brunswick de contribuer. Nous avons toutes les responsabilités de soutenir notre économie si nous sommes en mesure de le faire. Et cela comprend soutenir la chaîne alimentaire de Nouveau-Brunswick. The agriculture and fishing industries will be looking for workers in the weeks ahead. If you are looking for work opportunities right now and have a willingness to learn, I am calling on you to step up and make a valuable contribution to our province at such a critical time in its history. Businesses in all industries are looking at what they will need to do to adjust their operations so they will be able to reopen safely when the time is right. Alors qu'un plus grand nombre d'entreprises commenceront à ouvrir leurs portes au cours des semaines et des mois à venir, elles devront évaluer et atténuer les risques. Pour cela, il faudra planifier et établir de nouvelles façons de procéder. One of the best ways to mitigate risk is to practice physical distancing. Every business should assess their physical space for ways to stay at least 2 meters away from others. If this amount of space cannot be maintained, businesses will need to take other measures, such as using face masks. Signage should be publicly available for employees and customers with advice about measures everyone can take to stay safe. I understand that each sector is going to have unique needs and requirements. That's why we are currently working to develop engagement sessions with specific sectors. This will provide businesses with opportunities to hear directly from officials at Public Health, WorkSafe NB, and relevant government departments, and will give business owners the chance to ask questions. Opportunities New Brunswick will also publish a new webinar on Friday of next week about economic recovery. It will feature an expert panel providing tips and answers to common questions that businesses may have as they get ready to reopen. J'ai vu des exemples d'entreprises qui prennent des mesures comme installer des barrières, commander de l'équipement de protection, ouvrir les services en ligne ou reposer les stations de travail pour respecter les règles de distanciation physique. J'apprécie que plusieurs propriétaires des entreprises travaillent de façon proactive. We will continue to work closely with businesses to make sure they have the information they need to operate safely. More details about how to develop an operational plan and information such as signage templates are available on the GNB coronavirus website under the New Brunswick response icon. The situation is evolving constantly, and we all have to be prepared to be flexible and make adjustments to our behavior as needed. Last week, we announced our phased plan for recovery, which included different stages our province will reach in the weeks to come. These levels lay out various sectors that will reopen and activities that will be permitted as we continue to make progress. But I want everyone to remember that this situation is fluid. We may be able to loosen restrictions on one type of business included in a certain stage, while still restricting other activities that are part of the same recovery phase. Nous évaluons la situation sans cesse et nous écoutons les conseils de la santé publique sur ce qui est sécuritaire pour nous les gens de Nouveau-Brunswick. We have reached 11 days with no new cases, but that doesn't mean we won't see new cases in the future. If we do, that will not mean we have failed. Our goal all along has been to flatten the curve, and we are achieving that right now. We have succeeded so far by not overwhelming our healthcare system, and we certainly want to continue in that pattern. If we all continue to follow the directions of public health and obey the emergency order, we will continue to succeed. Let's continue our work together as we recover. If we all do our part, we will emerge as a province stronger than ever. Thank you. Merci.
Merci, Monsieur le Premier Ministre et Dr. Jennifer Russell. Thank you, Dr. Russell and Premier Higgs. We will now proceed with questions from the media. You have the right to pose the question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Elizabeth Fraser, CBC.
Hi there, my question is for Dr. Russell. What kind of impact did the addition of symptoms yesterday have calls to 811 and the number of tests carried out? Can you break down the number of people who sought testing by calling 811 and the number who were actually told to get it?
We do have the number of calls for 811 every day. I just don't have it off the top of my head, so I can get it for you. And the other thing is for the actual number of tests, they went up to over 260 tests that were done in the last 24 hours. But in terms of the 811 calls, again, I know we have that information, and I can get that for you tomorrow.
Do you have a follow-up?
Yes, I do. Thank you. Another question for Dr. Russell. The House doctor for the CBC Information Morning Program in Fredericton today said he believes that if the province can get 21 days of no new cases, then it can be considered free of the virus. Do you agree with that? And what does that mean for what we do, or are there pitfalls to that way of thinking?
Well, so from a public health perspective, what we know is that we will continue to be at risk for travel-related cases. I can't even say that we won't see any more community transmission cases. We have borders all around us from the U.S. to Nova Scotia to Quebec. I won't say PEI because PEI has very good numbers right now. But I think we have to remain vigilant as a province, knowing that the risks are there. Nobody is immune from having new cases of the virus pop up at this stage. So I think that we really need to be careful how we message that information to the public and be realistic about what it is they need to be expecting moving forward. So again, I would never want to give somebody a false sense of security that just because our numbers are zero right now, and even after 21 days, there are other jurisdictions that have seen a second wave. We fully expect to see a second wave in this country, in this province, like other jurisdictions have seen. So we have to be very, very prepared for that, and that's why the phased approach to lifting restrictions, reimposing restrictions is part of the planned phased approach. Again, we have to be realistic and we have to be prepared for those risks, and that's what our public health colleagues and our colleagues in the Department of Health, and then our all-of-government approach, so all of the GNB coordinated events that are happening right now are so important. And to come back to your question about the 811 calls, we received 301 calls yesterday, and we had 152 referrals to the assessment center yesterday.
Thank you, Doctor.
Thank you.
Thank you, Ms. Fraser. Silas Brown, Global TV.
Hi, Premier. We've seen neighboring Nova Scotia just unveil a loan program for municipalities to help them bridge the budgetary shortfalls that many of them are going to be facing. Similarly, a couple of weeks ago, out in British Columbia, the government took steps to allow municipalities to run deficits. I'm wondering if either of those two options are being looked at here, and if you're getting close at this point to being able to come up with some sort of plan when it comes to what municipalities are going to do when it comes to budgetary shortfalls.
So while I'm not familiar of the Nova Scotia plan that you reference, I did have a discussion with all the municipalities about 2 weeks ago. And we did speak about the municipalities, the Financial Act, and the ability for municipalities to run a deficit, and that most likely would certainly be something we would be considering, the same as BC has done. I expect to see that in most provinces, actually. We said we'd work with each municipality on a case-by-case basis, because as you can imagine, it's certainly widespread that the financials are very different now than they would have been 2 or 3 months ago. So we will continue that philosophy. We'll work with each municipality on their situation and understand how the province can be a partner in ensuring that they too recover, because after all, it's these municipalities make up our entire province, so we have to work together on the recovery plan.
Thank you, Premier. Thank you, Mr. Brown. Do you have a follow-up today?
Yeah, the Federation of Canadian Municipalities has called on the federal government to step in with some sort of aid package. Would that be something that you would support, to see, direct aid coming from the federal government rather than maybe the provincial level?
Well, actually, I think that anything coming from the federal government should be working through the province, the respective provinces in government, to be then dispersed into the municipalities. That would go in terms of an aid package, or in relation to, let's say, infrastructure investments. Certainly the norm here in the protocol would be that we are working as provincial leaders across the country. I have another call in this regard tomorrow night with not only my provincial colleagues, but with the federal government, to express kind of in unison some of the concerns that we all jointly share. So in order to keep as much, continuity in the process as possible, and that we understand each other's concerns, and we're not just continually chasing one headline after another because of what one province has done versus another, it's important that we stay aligned and that we have this communication link that goes directly to Ottawa.
Thank you, Premier. Thank you, Mr. Brown. Laura Brown, CTV.
Hi, Premier. You might have said this earlier, but I didn't quite hear. How many temporary foreign workers do we usually have in the province? And I guess, how many do we have permission to have in the province from the federal government?
So right now, we have about 1,500 here in the province that have been here for a while, and those are the ones we're looking for an opportunity to actually relocate as needed, because many of them are unemployed as a result of this situation. That's our understanding. We had a request for through this next several months for 600 more, and those 600 are the ones that we are trying to replace, both with the people that are here now, the 1,500, and move them around, as well as through the connection with 70,000 people in our province that are unemployed. So it's a very small number in terms of what's needed, considering, especially when you look at the workforce that we have in the entire province. So we should very easily be able to fill the need of our farmers, our fishermen, our processors, and all of these individuals. And I think, you know, going forward, or at least on average, we have about 2,500 temporary farm workers in the province on an annual basis.
Thank you, Premier. Do you have a follow-up today, Ms. Brown?
Yes, on the lobster fishery, I'm sure you're hearing the calls, I guess, calls on either side to allow the season to take place on May 15th as planned, and then there's some calls for it to cancel. Where are you at with those discussions? And I guess are you aware of the people that are calling it catastrophic that the season, if the season were to be canceled?
Well, yes, I am aware, and I am aware that in my discussions with the Deputy Minister Freeland the other night, that I mean, it is a federal decision. It would be a decision made by DFO, and I would. It's my understanding now the season will be moving forward as scheduled, but I haven't heard, because I haven't heard anything differently on that. But my point would be this: that if we look beyond the season and say, where is the market? What's going to happen to the lobsters that are caught, or other fishing scenarios? What's going to happen to this, and where's the market? That's the question, and that's why you kind of say, are we just moving into what's an obvious problem? But nevertheless, if the federal government, you know, continue with the date, and if the fishermen want to have a startup date of May 15th, then so be it. We will work with the processors to supply the people that they're looking for, but in doing that, I'm saying I am counting on and confident of the many people that are going to come to the plate here and say, I can help my local farmer, I can help my local fish processor. I can be part of this solution in order to do my part to continue to keep our province safe and healthy and not pose any unsafe risks or any additional risks during this health pandemic.
Thank you, Premier. Thank you, Ms. Brown. Callum Smith, Global.
Hi, Premier. I understand you're saying there's 70,000 unemployed people in the province, but to that point, impacted industries say the average person isn't cut out for processing jobs, agriculture, seafood, because they consider these positions of trade, and like many other industries, they're obviously requiring a specific skill set. One farmer said it could take 3 people to replace one temporary foreign worker. I guess, how do you expect that the people within can fill that void if this is such a specific skill set?
Well, I guess if they're looking for a 3-to-1 replacement, given the numbers that we have unemployed right now, we can certainly handle that. So that won't be a concern. In relation to the training requirements, yeah, I respect the fact that every job has its unique skill set requirement, and there would be a need for some training with many, or there may be many current people that actually have experience in these categories. Because, you know, I go to the fact that given the large number of people we have available, it isn't a big demand. It isn't a big concern in relation to numbers. So I would be, again, confident that we would have the people that could either have the right skill set or certainly be trained to have the right skill set in a relatively short period of time. And let's face it, in relation to the timing, if we're talking about the fish processing plants, you know, we're looking at May 15th and beyond that, because all of the temporary foreign workers were to be in isolation for 2 weeks. So we have 2 weeks not only to find, you know, the 100 or 200 people that were needed in the fish processing, if we're talking about that, and say, okay, let's put them in the area and let's have this training program in place. But, you know, let's give New Brunswickers a chance to just show how good we can be. We are very blessed right now to be in the situation we are in related to the COVID crisis. And every day I'm thankful that the number is 0 on the death count in our province. And I want to keep that number at 0. And I'm sure there's not a person in this province that doesn't want to be part of doing that very same thing. So let's just all pull together and continue our success story to date, because none of us will do this by ourselves. But together, we will continue a track record that is second to none. And I'm excited about that because, you know, many cases, New Brunswick's is in different factors, but we're not often in first place. Well, since the beginning, I've said, you know, we can be in first place. So let's start right here in this crisis. Let's be in first place and have our people recover from this, have our lowest count in the country, and let's be part of a solution together.
Thank you, Premier. Thank you, Mr. Smith. Do you have a follow-up today?
I do. Just looking for some clarity on the numbers, Premier. I think I heard correctly, and again, wanting clarification that you said there's 2,500 temporary foreign workers annually, and right now we have 1,500, and there's a request for 600 more. I want to know where that request for 600 came from, and I mean, for me, that math doesn't quite add up.
Well, you're right. As on average, 2,500 is the number we have in the province throughout the year. So that's but it's seasonal, so it comes and it goes, but 2,500 is usually at the peak. Right now, we've had 1,500 in the province at various locations throughout the province. 600 are currently being asked for from the federal government, but they're throughout the province again at various locations. The fish processing plants would account for, I think, about 175 of that 600. So right now, what we know, and many of these programs are worked directly through the federal government, so a business will actually apply directly to the federal government, and we are now working to get visibility into that, so we can work with specific companies, and we're asking specific companies to come forward. So I know it's easy to say, you know, my business it can't start up as normal, but nothing is normal right now. And so what we want to be sure is your business it can and it will start up. And that we will find people that are able to help your business succeed. Because that is what it's all about here right now. Staying healthy and building the road to success.
Thank you, Premier. Thank you, Mr. Smith. Vicki Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for the Premier. Premier Higgs, I apologize for being repetitive, but you mentioned yesterday that you'd have a start date today for the Campbell Ferry. Has there been any new developments or further discussion on that?
My apologies. I did not get a date as promised. I will leave your contact information and I will call you.
Thank you.
Thank you, Premier. Follow-up today, Ms. Hogarth?
I do. Thanks, Bruce. It's for Dr. Russell. Dr. Russell, now that we are slowly opening up the province and expanding testing protocols, but we still recognize that nursing home residents will remain our most vulnerable group of people, do you plan on testing nursing home staff and residents regularly to detect outbreaks early?
So there's a couple of things happening with our testing strategy. So we've always taken guidance from the national level. So Public Health Agency of Canada does provide some, along with the Special Advisory Committee, some advice on moving forward with our testing strategy. So I'm meeting with my medical officers and my public health team at the Office of the Chief Medical Officer of Health tomorrow night. So we are looking at the numbers that we have right now, looking at all the options for moving forward, and definitely will be considering all of those in our conversation tomorrow night.
Thank you, Doctor. Thank you, Ms. Hogarth. Matthew Wacomo, l'Acadie Nouvelle.
Bonjour. Ma question est probablement pour le Premier ministre Higgs. Dans la plus récente déclaration de l'état d'urgence, on permet dorénavant les gens qui arrivent au Nouveau-Brunswick par Campbellton de rentrer faire des achats de première nécessité. Je me demandais à quel moment ça avait changé et puis qu'est-ce que ça veut dire là, exactement pour la population.
So if, in the case of the communities, we have said that, like in the case of the Campbellton area, it's the nearest location for people on the opposite side of the border to actually get normal supplies, whether it be grocery or whether it be drugstore supplies. And so we have a program there where we know who's coming. It's a routine now, and they're allowed to come in, again, following all of the protocol that we have in place. To do just that and then go back across the border. I don't think that's new. I think that's been something that's been in place for a while. I think there's one thing that may have been changed was the local community had developed a pass system. And it was just to provide greater controls and understanding of who's coming, who's going, and for what reason.
Thank you, Premier. Merci, Monsieur le Premier ministre. Monsieur Roy, comment as-tu suivi cet après-midi?
Oui, s'il vous plaît, sur le même sujet. Je veux juste m'assurer de bien comprendre, parce que dans la déclaration d'urgence, c'est pas limité à une certaine population. Là, ça semble ouvert à tous ceux qui arrivent à Campbellton et qui ont besoin de faire des achats de première nécessité. On va peut-être clarifier ça. Et aussi, en discutant avec des gens sur place, c'est pas tout le monde qui semble être au courant de cette possibilité-là. Pouvez-vous nous garantir, par exemple, que les agents de la paix là, laissent entrer tous ceux qui doivent faire des achats de première nécessité à Campbellton?
Well, certainly, if they're there to purchase necessities and the reason to do that is for that reason, they're allowed to do it. And so there's no reason, I guess, for any change in that. So as far as public safety, I guess what would make that different is if, let's say, people were showing up on a regular basis that weren't able to justify why they were doing what they were doing, or let's say they're coming 5 or 10 times a day to purchase essentials. There might be a request, well, why don't you come once a day and do that? So and I have asked for this information just so I understand what is the cross-border traffic, what's it look like, who are we turning back and for what reasons? Because we want to be fair to our neighbors, but we want to be realistic about protecting public health and safety. So I would say if there are people that aren't coming through or are saying I'm going for essentials, it may be multiple trips, and public safety is just trying to limit those trips.
Thank you, Premier. Merci, Monsieur Wacomo. Jim Dunville, River Valley Sun.
Thank you. This is for Premier Higgs. You were talking about the preventing foreign workers from coming in. I would like to know what's happening with all out-of-province workers. For example, we have been told that AB Nakawik brings in skilled workers from Quebec and Nova Scotia during its maintenance shutdown. How is this different from foreign workers, and how can we be sure that they don't bring in the virus?
So in the case of what we're working with companies on and understanding who's coming through each border and for what reasons. Now, there still is commercial activity happening. We know commercial traffic is coming through our province. We know it's coming to other businesses in our province because they are still up and operating. So in this case of a skilled workforce that is, working on machinery, working on a shutdown, and can that workforce be replaced by people in the province or can it not, is certainly a valid question. But we are trying to ensure that people are coming to their place of work. They're leaving, going back home, or they're basically they're staying for long periods of time. In the case of a shutdown, they could be here for many weeks. That is part of the ongoing scrutiny of what's coming and going across the border, but also balancing to keep our businesses running. We have the same thing in the Quebec border. We have people coming across every day to work in the hospital in Edmonton, maybe going the other way. So we see that activity on a routine basis. It's part of, in that case, an essential service in the health side, but it's also, we keep part of essential service of keeping people employed, keeping businesses running, and then trying to gradually change or ramp up.
Thank you, Premier. Mr. Dunville, do you have a second question, a follow-up today?
Yes, I do. Getting back to the farmers, I've been talking to farmers, and they're telling me that the trained temporary foreign workers have the skills that are needed, and without them, the productivity will drop seriously, even with new people coming in and filling those positions. How will the province address the associated food security impact? Most farmers are telling me the production of food will drop significantly without the foreign workers.
Well, I know that immediately, we kind of think of the worst-case scenario, but the worst-case scenario is that our health situation deteriorates, and we have an outbreak of the virus, and it becomes far widespread, and we're not in control of it like we would seem to be today. I mean, that's the reason that any of these things are being looked at. So I'm asking, just as many businesses have actually closed, and now we're trying to find a way to reopen. I'm asking the farmers and the producers here in our province to say, okay, I know it's not business as usual. I know I'd like to have a temporary farm worker that, has been coming here for the last 10 or 15 years. But I really I can help because I can work with other people. I can train them. As an earlier question was, it might take 3 workers to replace 1, but we should be able to manage that. So I know it's not going to be business as usual, but it hasn't been for the last 2 months. It's certainly not business as usual for everyone in this province. So let's just keep on a program and a path that'll minimize the risk to our citizens, and we'll work with every farmer here to see that they can produce as much this year as they did in previous years, because our goal is to get back to the new norm and a production system that feeds our population.
Thank you, Premier. Thank you, Mr. Dunville. Andrew Watt, Telegraph Journal.
Hi, my question for the Premier. Premier, so you're publicly talking about potentially bringing in an app that can help track coronavirus cases. Is this definitely coming? If so, what is the timeline, and what concerns, if any, should New Brunswickers have about being monitored by the government?
Well, first of all, it isn't definitely being implemented. There's a lot of studies being done in order to understand what is the ability to be able to track the virus. The whole reason any of this is being considered is if the contamination, if the widespread contamination actually is occurring, that we're able to find some way to follow it. But obviously, all of the privacy rules have to be followed. We have to make sure that people are comfortable. It is a voluntary program in which people would participate in. So I guess firstly, we're not ready to roll out anything. Secondly, it would be voluntary. And thirdly, it would be based on certainly our health situation, saying that we have a real concern and we need to be able to make that possible option if it gets out of control. And I'm saying we're doing everything we can so it does not get under control. This app is not available, I don't think, anywhere at this point in time, and it's something that is just currently under development to help with a crisis such as this, if and when, and available to be needed.
Thank you, Premier. Thank you, Mr. Watt. Do you have a follow-up today, Mr. Watt?
I do. So getting back to the temporary foreign workers issue, my colleague Adam Puris interviewed an immigration lawyer from Moncton this morning who said that this ban on temporary foreign workers is also going to ban doctors coming in, that they're trying to recruit to fill vacant healthcare positions. So my question is were you aware of that? Is that correct? And if so, are we kind of cutting off our nose to spite our face here a little bit?
Well, firstly, there is a difference between a temporary foreign worker and an immigration policy, or immigrants coming here for full-time employment and full-time, residence. So it would appear that that's what you're talking about in this case. So immigration will continue, and we will do the one-off, two-off cases in relation to employment is found here in this, and in your particular reference in terms of healthcare and the needs that are there. And you're right. If we weren't able to find a way to safely make that happen, would we endanger others because we were running short of professionals to do this particular role? So I guess, so there are two different scenarios. In that case, you're talking about immigration. In the other case, we're talking about temporary foreign workers and people that we think, we can utilize many of those that are here in the province to help us through this crisis. So, we'll be back to a normal, as it may be different one day. And our temporary foreign workers, as we are discussing today, we'd be able to continue the program. But today, let's not take unnecessary risk.
Thank you, Premier. Thank you, Mr. Waugh. CHCO-TV, Radio-Canada.
Merci, Bruce. J'ai une question pour Dr. Russell. Dr. Russell, j'aimerais savoir qu'est-ce que vous-même pensez de l'idée d'avoir une application sur téléphone intelligent pour surveiller les déplacements des gens afin de savoir s'ils entrent en contact avec des porteurs de COVID-19.
Alors, comme le Premier ministre a déjà dit, c'est une idée qui est là au sujet d'avoir quelque chose qui est disponible comme ça pour faire plus d'investigations, avoir plus d'informations là-dessus. C'est pas quelque chose qu'on est préparé à lancer maintenant. Il y a beaucoup d'informations qu'il faudra retenir là-dessus avant qu'on fera cette décision.
Merci, docteur. Monsieur Corriveau, as-tu un suivi?
Oui, Bruce, merci. J'ai un suivi sur le même sujet pour le premier ministre, M. Higgs. Alors, M. Higgs, quand on parle de cette application-là pour COVID-19, j'aimerais savoir de quelle application spécifiquement parlez-vous? Elle est développée par qui et ça viendrait de quel pays?
So in terms of the application, are you referring to a particular country in relation to someone coming in here to be employed?
Non, l'application pour l'application dont vous avez parlé déjà là, pour surveiller, tracker les gens là, qui auraient le COVID-19,
Okay.
qui seraient près des gens qui ont COVID-19. Exactement la question à laquelle vous avez répondu par à mon collègue monsieur, du Télégraphe tout à l'heure.
Yeah, oui, merci. The issue is in relation to this app that's being developed is in conjunction with UNB and working, it's not available at this point. So it is very much in a developmental phase that we're actually doing here in New Brunswick. We'll be working with our colleagues across the country as such. But, I guess if I think about if it'll be used and when it'll be used is certainly yet to be determined. But it's looking at technology and is there a way to track a virus? Is there a way that's acceptable to the public? Keeping in mind that it's certainly always voluntary and it's just one more measure that it's important for us to consider. And it's kind of exciting that our Department of Health is leading this initiative, just looking for new and innovative ways to best safeguard our population.
Merci, Monsieur le Premier ministre. Merci, Monsieur Corriveau. Adam Harris, Telegraph Journal.
Thanks, Bruce. Premier, just on temporary foreign workers, so there were 5 specialist doctors and 215 truck drivers entering the province in 2019 as temporary foreign workers, according to federal figures. They used that stream to get into the province. I'm told there's applications for both currently. The Truckers Association told me today that they're awaiting temporary foreign workers to drive transport trucks right now. Will you turn away truck drivers or potentially doctors, or are there any exemptions here?
Well, at this time, what I've asked for, because I've been told that there are 600, and what brought this to a head was certainly the whole discussion around the processing plants and what we have, learned about from other aspects of this sort of operation in other provinces or other countries, and how do we minimize risk. So that's what prompted kind of moving quickly, because this was an immediate need, but also to give us time to find replacement for people in the plants. I've been told there are 600 actually current applications in. I've asked for details of those 600, and we will go through each one of those so we understand the specific needs of each company or each profession or whatever the case may be, and then make the decision based on that, whether it is something that we would be able to meet those requirements right here in New Brunswick, or whether it's not. So to say it's, and it's an absolute, I think would be unfair until I understand what is the criteria for the current 600 that I'm aware of.
Thank you, Premier. Thank you, Mr. Harris. Mr. Harris, do you have a follow-up today?
Yes, please. Again, on temporary foreign workers, by all accounts, I'm hearing that this was done over the weekend. And as late as Friday, provincial officials were advocating for temporary foreign workers to come into the province safely. Is that true? And why the sudden change of heart?
Well, it wasn't as of Friday. I think it was before that. I mean, we had our meetings before that. So, I mean, when we're in a position right now to have certainly, I think only 4 active cases, no one in hospital, or maybe one, but not in ICU, 0 deaths, and you look at risks around the country and around other countries, and you say, where's our next exposure? What can be something that would potentially spread a risk to multiple people? Then you say, why are we doing this? Do we have options? So it's one of those things you can sit around and think about it, or you can act, and we chose to act.
Thank you, Premier. Thank you, Mr. Harris. Adil Ibrahim, CBC.
Thank you. This question is for Premier Higgs. What support, either financial or in terms of just advice, are you making available for small people-facing businesses? They're trying to figure out equipment and mechanics of starting up again, but they don't really know how to go about it.
Well, actually, we have a good system set up for contact. I mean, we've had a navigator program set up from the beginning. I think we've had about 1,700, 1,800 businesses connect with that in terms of getting instruction. We have basically rolling out a 30, 60-day proposal for recovery, and that's, that's an economic recovery. So that's working with businesses that are maybe in a position that they can start up sooner than others, and because it is less onerous. And it's also understanding kind of individually what businesses and their concerns are. I think it's important to recognize that, it is a difficult situation, and it is a situation where likely not all businesses will restart. So, and I think many businesses have to think about how they restart differently, not only to meet public health requirements, but maybe to kind of face some of the challenges that we have going forward, and how we're going to kind of compete in this new world or this new market. And what market opportunities maybe this provides. Many businesses have learned that, with multiple employees at home, that they can operate differently. I mean, we've certainly been learning that through the government operations. We've certainly been learning it here in New Brunswick, working together with the COVID Cabinet Committee and with other cabinet members, that there's an opportunity to find a focus here to bring New Brunswick back like no other province. I am convinced that our businesses will come back bigger and better and stronger. But I guess thinking, will they all come back? I'm not, time will tell, but it's probably unlikely.
Thank you, Premier. Ms. Ibrahim, do you have a follow-up today?
Yes, for Premier Higgs also. We've been getting a lot of questions about daycares. Can you give us an update on the percentage of daycares that will be able to get back in business in the next phase? And also, can you tell us whether people who can't find daycares will still be expected to return to work in that phase?
Right now, we have about, I think, over 600. I think there's 850 daycares, if I know the number correctly, and I think we've had close to 600 that say, I want to get back up and running. So we're seeing a great connection there with others to actually help businesses get up who are going to need daycare service. So we think we're seeing, once again, we're seeing New Brunswickers step up and say, look, I know businesses need my service in order to get going, in order for employees to get back to work, and we're going to be there. So it's another example, and I guess I'm excited that we're seeing that sort of willingness to step up. And I guess one point, I did get a note in relation to the startup for the ferry. At this point, the ferry is scheduled to start up to Campobello on June 29th, but we are looking at options to move that forward.
Thank you, Premier. Thank you, Ms. Ibrahim. That concludes today's update. Thank you very much. Voilà la fin de notre mise à jour. Merci beaucoup.